YouTube. Good guess, though. Has anybody been there? Okay, we're live on YouTube. All right, welcome everybody. We got a great video for you. This is going to be covering anesthesia and your vagus nerve. Very interesting collection of subjects. We'll talk about why am I uniquely qualified to talk about this. But first, before we go into that, most importantly, we're going to do this simultaneous squeeze. So everybody, you know the drill. We're going to take a big deep breath in, fill up our lungs, and then squeeze and hold and press and exhale, but restrict the exhalations in your mouth. And it's going to make you feel a rush of your vagus nerve, and you're going to get kind of high. It's going to feel amazing. Let's all do this together. Ready? Here we go. In 3, 2, 1, breathe in. And you can take a little sip at the top and hold it. Squeeze. And exhale. There we go. Oh my God. Feels so good. Honestly, best part of the whole video. Just that. I hope you got some effect out of it. I really do. Anyway, big announcement for everybody. I switched out my iron neck behind me. You'll notice that that circle that I usually have behind me is now my iron neck 2.0, and I've begun to use my 3.0 outside, which is a big change for me. I've been using, I bought the iron neck 3.0 Pro, the newest one, and I wanted to keep it as a souvenir almost and say, you know, I'll continue to use my iron neck 2.0 for as long as I can. And I switched it out because it's got a smaller circumference. It's got a smaller radius and diameter around the head. And it enables you to do these really nice tight circular movements on the 3.0 Pro. And you can tighten the resistance really carefully. And I've been working out my neck a lot. Can you guys tell? Can you guys tell? I don't know if I show you. You see any difference? You notice anything? Anybody? You notice any summertime? Do you guys notice any kind of anything going on here? I don't know. I've been hitting the iron neck pretty heavy. Doing some exercise outside, getting some sun. Woo! Love it. Summertime in the Pacific Northwest is pretty hard to beat. Just saying. It's pretty nice. So anyway. All right. So why this subject today? Well, I was on Twitter today, and one of my absolute favorite people ever, Dr. Stuart Hameroff, was having what I think is fantastic discussions. Let's call them arguments, but for the sake of argumentation, discussions, scientific education time with some people on Twitter about how does anesthesia work in the brain. And he has this theory of consciousness showing that microtubules have quantum channels in them, and anesthetic gases bind up close to the microtubules and knock consciousness out of line. And that's how anesthesia works. So if you can understand that, then you can start to understand what is consciousness itself. If I showed you that anesthesia acts on microtubules, and when anesthesia knocks out consciousness and it's clumping up around microtubules and interrupting the flow of information up and down a microtubule, then it would be almost so obvious to say, well, clearly microtubules have got to have something to do with the emergence of consciousness. And so this is kind of that discussion. I'll put some stuff here on Twitter also. I'll put on Twitter, which is Dr. Stuart Hameroff, who is fantastic. If you can, go give that guy a follow. Honestly, me, whatever, who cares? Stuart Hameroff, though, that's a guy that you need to go and follow on Twitter, because he's got to be like IQ 185 or something like this. This guy is an incredible genius. He's a good looking guy too, if you know what I'm saying. Drives a Harley Davidson. He's a cool guy. He's internationally known. I mean, he's known to rock the microphone, if you catch my drift. So go give him a follow. A lot of this stuff that I'll talk about today will make a bit more sense. But I have a question for everybody. Who here has gone under anesthesia? Type a 1 in the chat if you've ever gone under anesthesia of any kind. If you've gone under anesthesia for teeth removal. The first time I ever had anesthesia was when I got my wisdom teeth removed in the back of my mouth. Okay, so Lori, you've had anesthesia of some sort. I think everybody's had that experience where you're like, I want to see how long I can count without going under. And you think, I'm going to beat it. I'm going to beat the anesthesia. So you go under the anesthesia in a hospital and you count from 10, 9, 8, 7. And almost the funniest thing is, by the time you're to like number 7 or 6, you're gone. That's the craziest thing about anesthesia. I think that they know that. They ask you to count down once they've already injected the milk of amnesia into your body, the propofol, which is that white liquid. They know that you're out by the time they ask you that. There's not a chance that you're gonna not be out. So it's just crazy. And I think they know that. They want you to count backwards so they know exactly when to start the procedure. Super wild. So anyway, in the whole history of understanding anesthesia, the general thinking was that anesthesia would act in the synapses between neurons and that it would interrupt the flow of information. That turns out to be wrong and impossible. Anesthesia isn't capable of binding into a synapse. The only place where it binds are in like fat-soluble pockets in your neurons, and that would happen to be your vagus nerve. Places where your vagus nerve is cumulative, and also certain types of neurons in your brain, usually pyramidal neurons. So the funny thing is, where do anesthesia gases typically enter into your body first? Well, they're going to enter in usually through your lungs. They're usually going to use gaseous, nitrous, or other types of, I don't even know, a bunch of inhalable anesthetic gases that they use. Nitrous is definitely one of them. But they're going to basically put you under really quickly, and they're going to remove consciousness. But the funny thing is that even anesthesia medicine as a field doesn't even speak that much about the effects of anesthesia on your vagus nerve. And I think that's a very important topic to cover, because if what Stuart Hameroff here is saying is true, that anesthetic gases bind to microtubules, then we can also say, well, the vagus nerve is the largest and longest superhighway of microtubules in your entire body. More so than even in your brain. There's a lot more in your vagus nerve than in your brain. And it's also in your brain is specifically the access point where inhaled anesthetic gases are going. So when you inhale an anesthetic gas, it goes into your lungs, and then there's little channels of your vagus nerve that are also there as well. Those get shut down. You lose consciousness. You lose emotions. You lose something. So it makes me wonder as well if the action of an anesthetic gas isn't primarily relegated to the brain, could anesthesia be knocking out consciousness by knocking out body consciousness first and then the brain follows? It's not too crazy to ask that, because if you cut your vagus nerve in your neck, you lose a level of consciousness that people aren't willing to accept. For instance, what do you guys think? How do I frame this question properly? If you have two types of people, and one person has all of their emotions, and then another person, okay, let's say there's person A has emotions and person B has no emotions at all. That would be a condition called like depersonalization, anhedonia, derealization, kinds of stuff I see a lot in vagus nerve damage all the time. So, but person A, normal, healthy, full emotional spectrum, can get happy, can get sad, can get angry, can have joy, nostalgia. They've got the full gamut of emotions. That's person A. Person B, no emotions. Could you say that out of the two, which person is more, could you generalize to say that either person A or B has more or less consciousness than the other person? That is, if you know what consciousness even is, which I assume most people, if they thought about consciousness, they'd understand that they have consciousness. But I understand that's not a factor or a thing that most people just go, yeah, well, of course I have consciousness. Of course. But would you say that person A with the emotions, all things being equal across the board, would you say that emotional spectrum is a higher level of consciousness than a person with no emotions at all? They are completely flat on the emotional scale. They can't be happy, they can't be sad, but they can think, they can problem solve, they can have a conversation. There's no deficit there. Something bad can happen, but they don't feel it at all. They have no emotional feeling whatsoever. I would say, well, what would you say? What is your thoughts? Which one has more consciousness? And write it out. The person with more emotion has more consciousness. So you'd write like person A. Or would you say neither? Because you might say, well, emotions aren't consciousness because, I don't know, what would be your rationale for saying that somebody with full range of emotions versus someone with no emotions whatsoever, that there's no difference in consciousness levels, that consciousness is something else? I mean, consciousness is a lot of things, but what do you think? Does somebody with all things being equal, they have the same, let's say they're at 150 IQ, they're both smart people, they both carry a job, they're both married, they have children, they've got friends, everything being equal. They both take their trip to the Bahamas once a year, right? Two identical people, twins even. But let's say that person A has an emotional experience of everything that they're doing. They can be happy, they can be sad, they have joy, they feel nostalgia, they feel emotion when they listen to music. That's version A, that's person A. And then person B does everything that person A does. But when they listen to music, they have no emotions whatsoever at all. Could we say then, potentially, that the person A, who has all levels of consciousness, plus they can feel emotion, is more conscious, has more consciousness range than the person without emotions? Who has more consciousness, basically? It's either going to be A or none. I guess the only answer is either person A or none, because you would argue that either there's no such thing as consciousness to that degree, maybe we have no free will, you don't believe in consciousness, or that's not the right way to place it. But I'm curious, Take a guess. I know we've got people watching, so shoot out some answers. What do you guys think? I'll wait. Also, I'm not sponsored, but I'm going to be drinking my delicious water today. Ooh, so good. So I'll wait. In the chat, does having a wider, broader range of emotions make you more conscious than an identical twin who has no emotions at all? Do emotions contribute to your cap on consciousness, basically? What do you think? Yes or no? Yes? Yes, emotions, and the more emotions you have equals more range of consciousness experience, or no? No. No is no. Yes is yes. I don't see any answers. Guys, come on. We've got some. This isn't a mind-blowing question, or maybe it is. Maybe you guys are like, oh, I can see a lot of you going, oh, I don't know. Do I have to create a poll? Question. Okay. Yes, it is mind-blowing. Okay, cool. I like that it is mind-blowing. That's helpful to hear. I'm super happy to hear that. But I'm here. No, guys, I'm curious. I see there's 7 people here. It's not just Lori. Is there something more about a wider range of human experience and human consciousness if you add emotions to the process versus someone who has like robotic affect? Is there a difference? Right? I noticed that there's a difference. Do you guys also notice? Okay, thank you. Okay, Marianne, thank you. So yes, there's an observable difference in the conscious experience bubble when someone has more emotion than someone who has no emotion at all, even if they're doing the exact same things. Okay, cool. And then Bevan, thank you. Appreciate it. What the hell took you guys so long? Jeez, I've been asking the question for 5 minutes. I know. Okay, if you were legitimately thinking about it, then I appreciate you putting the time into here. Here's why is that a potentially important question? The reason why that's a relevant question is because the science shows, and I'm not going to get into a philosophical debate about using science as some kind of a thing to bash people over the head with. That's a whole different discussion. But asterisk here, citation, aka go Google it afterwards if you don't know. But they have absolutely mapped that the vagus nerve, the one that I talk about all the time, that vagus nerve, the one that's in your body, you have one, I have one, the vagus nerve, that it first generates emotions, and those emotions are then sent up as neurological signals into your brain, and that emotions are generated some milliseconds before they hit your brain, and without the vagus nerve present, no amount of seeing your daughter blowing out candles at her 4th birthday can cause an emotional reaction. And that it is an absolute observed clinical fact that if somebody has their vagus nerve surgically cut by accident, which usually happens during thyroidectomy or a cancer surgery or a throat surgery or a neck surgery, completely accidentally, no doctor today intentionally cuts the vagus nerve, but yet it still does happen, unfortunately. So, be mindful of what your doctor is doing mucking around in your neck. One of the biggest reported side effects of that surgical accident is no emotional affect whatsoever. Dead emotions. not the ability, like losing the ability to feel anything. When you listen to music, when you see your children, when something good happens, when something bad happens, when the vagus nerve is cut, when the vagus nerve is damaged in any way, you lose emotions. And they also found, and completely separate from that, that's not the reason why they go, wow, well, the vagus nerve must be the source of emotions. They rigged people up to all kinds of sensors. They presented them with, it's crazy, with visual stimuli, with music that evoked emotions. And they found that there were signals for that emotion that started in their gut or their heart and then traveled up their vagus nerve into their brain, which is insane. So it's like stuff goes in your eyes, goes in your ears, goes down your vagus nerve. Your vagus nerve then determines, is this a good feeling or a bad feeling? And then it propagates that back up. It filters it all within like 3 milliseconds. It's a very fast process. It happens before you can even see it. So don't try to be like, if this is happening, I can do it really fast. No, it happens so fast. You don't even have time to process that happened. But that is the process. Something visually goes in your eyes. What's something that's emotional for you guys? Okay. In the chat, again, participation is huge here because I'm trying to teach you stuff here. Ideally, you'll listen to this and you'll be like, man, my perspective on the world was just upgraded so substantially from this one video call that I did with Sterling that I'm going to go into the world and be a more effective person. And this was fun. And I'm going to see things with a new lens. And that's awesome. And that's also going to be better if you participate. So share in the chat, what is one song or movie from your life that you've ever seen or listened to where you have some kind of an emotional reaction, something where you go, ooh. For me, I'll share, favorite movie is the one with Robin Williams and Dustin Hoffman from the 1990s called Hook, directed by Steven Spielberg. That, for me, that's like a childhood classic. I must have been like 6 years old when that came out, something like that. I don't remember exactly. But I saw that as a kid. I was like, this movie's awesome. Like Peter Pan and Hook and all that kind of stuff. So for me, I have a movie that has like such an emotional thing, right? It's like such nostalgia. Where if you played a clip of that movie, I would immediately have this visceral emotional reaction. Part of that too determines for me that that my vagus nerve is still working. You guys see that? It's a way to stimulate, but also to test. You can stimulate and test your ability to respond to stimulation. I think that's a very important thing that I don't think a lot of people get. They don't get it innately, but when they start to stimulate their vagus nerve, they start to see it. Stimulation of your vagus nerve should be capable of testing how responsive you are to that testing. Just like the way a doctor would use a little mallet and hit your kneecap and test your automatic responses. It's a way to test how much your autonomic system reacts. So, okay, in the chat, what is a movie or a song that does it for you? That has like, ooh, like that has a visceral, emotional feeling for me. I'll sit. I'm going to wait. I want you guys to put it in the chat. I know we've got like 9 people coming and going from this video. We're getting more. Hey, just notice, I've been doing this pretty consistently. We get more and more people showing up. So if you want to build something big, start small. And I don't really care if we ever go above 15 people, I literally don't want that. I'm just kidding. I don't care. That'd be great. Okay, cool. So Bevan, you got The Gambler. Great. That's a great song. Yesterday, Marianne. Yes. Great song. Yesterday. Yesterday, all my troubles seem so far away. And now they're here to stay. Yes. So, okay. So yesterday, for instance, or The Gambler, these songs. Oh, another Beatles song. Great, from Jennifer. Thank you, Jennifer. Good to see you. Really appreciate you showing up for this. So imagine. So think of these as a depth charge. Do you guys know what a depth charge is? Speaking of submarines, we've all noticed submarines have been big in the news. Back in the days of U-boats, ship destroyers that would go above the surface would drop a barrel called a depth charge, which would sink to a certain depth of 100 feet and then go boosh and explode. They were trying to intentionally set off a depth charge close enough to a submarine to rupture its hull so that it would also implode on itself. Because if you cause a little bit of a structural issue in a submarine, that whole thing will just crush everybody inside. How perfect. So think of a song like that, or a hook, right? Hook being the movie, but also the hook to a song. The reason that these music interludes are now used as commercial fodder, right? Why do companies spend millions of dollars to license 30 seconds of a song to play during the Super Bowl? Because they know that 30 million of you probably have like Yesterday or Imagine or The Gambler as like some kind of a deeply innate hook pattern in their brain, in their vagus nerve. Oddly enough, because it's your vagus nerve that is the thing that is responding, and just so we're clear, guys, what I am sharing with you is pretty massive stuff. I'm basically giving you an insight into how food companies hook you on food and music and television. They're doing some pretty insane psychogenic manipulation, okay, by using things that have an emotional hook. Now, because the song emotionally is like a depth charge, right? So think of it. The song and the movie enters in your eyes, the song enters in your ears. It gets dropped like a depth charge slowly over, milliseconds. If we're going in slow motion, drops down to the subconscious region, all the way down past your heart into your gut, right? That's where you get it. Everybody's felt the butterfly feeling, that feeling of the butterflies in your stomach. That's your vagus nerve, right? That's totally your vagus nerve. That butterfly feeling, that feeling you get, that's your vagus nerve, 100%. So the depth charge song goes down, it goes, and then it sends those emotions up into your brain. You go, and the dopamine starts flowing from your brain. So that is the connection between your vagus nerve and your emotions. When your vagus nerve is cut, your emotions no longer work. God forbid that any of you have in the future, any further deterioration of your vagus nerve. I hope for you, especially for Bevan, for Marianne, for Jennifer, and for everybody else watching, even though you didn't share, even though I asked you, what is a really deeply, what is something that hits? What's a song? What's a movie that hits you? Another one that I love is called "Everybody Wants to Rule the World" by Tears for Fears. And when I hear that song, I just go, it makes me so happy, like just deeply happy to hear that song. Just got so much nostalgia. There's so much memory connected with it, and I feel it in my body. So my hope and my wish is that none of you experience any kind of further deterioration of vagus nerve function, because the more your vagus nerve goes, the less those things will have an impact on you. And you might think, well, that's good because then I'll never have bad emotions, but it's not good because you'll never have good emotions either. It goes both ways. You're going to have the good with the bad. That is, they go together. They're going to always have to go together. So what's this all have to do with anesthesia? Well, what's this all have to do with anesthesia is that anesthetic gases typically are inhaled or injected in the arm. Some of the first places that they're going to act are going to be usually in your brainstem, but also in vagal nerve fibers. Your whole vagus nerve has an entire blood system going through it. Your vagus nerve is not hemoic, which means without blood. It's not true. Your vagus nerve is completely innervated with blood vessels. Your vagus nerve has blood vessels going through it. Did you know that? And if you pinch your vagus nerve even slightly, you can restrict all blood flow just through your vagus nerve. What do you think it's going to do to your vagus nerve if you pinch it and you cut blood flow and oxygen off to your vagus nerve? What do you think is going to happen? What would happen if I wrapped a cable around your pinky? Would your pinky become purple? Yeah. Would it die? Yeah. Would it atrophy and fall off eventually? Yeah. And yet some of you, I have one guy in the Facebook group, love him to death, know him personally. He's like, has anybody actually done this red ball thing for like 2 to 3 months? And like, did you actually see any results from it? And I'm like, okay, I tagged some people who have, and they're like, all clients of mine or people who have been in the Facebook group and like, yeah, I've been doing Sterling's red ball training for months. It's so good. I don't have any neck pain anymore. It's amazing. And I'm like, cool. The reason why that's so good is because if you have a weak neck, you're pinching your neck right here in the atlas bone region. Weak neck muscles don't contribute to a healthy neck. It's just a fact. Like, what you think that like, well, gosh, having more muscles in my neck, it must compress my vagus nerve even further. So if that's true, then I should just let my neck get really weak, like really weak, like no muscles at all, and then there won't be anything to compress my vagus nerve, right? No, that's not true at all. It's the muscles which hold everything in place properly so that your neck doesn't collapse on itself. Fundamentally, it makes absolute sense that your muscles should be strong in your neck. Do you think that your ancestors 10,000 years ago, if your chimpanzee relatives jumping through trees and shit were like, yeah, we want really weak necks. Weak necks are going to totally save us from anything. No, because the monkeys would see you with a weak little, tiny little pencil neck and snap your neck. They would come and kill you. So what was the shift between our ancestors and then today where it's like, yeah, I mean, muscles in your neck were important back then, but today in our society? No way. No way, dude. No, that's total. That is what I would classify as what smoking crack gets you, basically. It's that type of irrational thinking that I would say is probably, and I don't know this for a fact, but how crackheads think. But I don't know. I'm going to say allegedly because I don't want to get sued by any crackheads who are like, no. Anyway, yes, Barbara, you got it. Denial. I think it is denial. So again, what does this all have to do with anesthesia and the vagus nerve? Well, one of the biggest symptoms of cervical cranial instability, which is just a really fancy way of saying that your neck muscles are out of whack and they're pulling unequally on one side of your neck to compress your vagus nerve. They're basically pulling on your atlas bone to squeeze and cut off blood flow in your vagus nerve specifically, which is killing it internally, by the way. And the only way to move it is to move your neck. You got to move your neck. You got to have a big neck. Look at my neck. Look at that. You can see my neck muscles. My neck feels fine. When I do this, I don't get the crunching like I did 4 years ago when I was going to all the great neck doctors in San Francisco. You know, when I was getting neck care in San Francisco with doctors who are $100,000 a year in terms of insurance coverage to get them, my neck was always fucked up. My neck hurt. When I moved my neck as a 29-year-old back in the day, you could hear cracking and crunching at 29. And my doctor was like, yeah, you're probably going to have to get a disc replacement sometime in your 30s at the rate that you're going. I was like, well, is that how it has to be? Is that what's going to have to happen? And they're like, yeah, pretty much. And I'm like, I don't believe it. But I believe that you got to strengthen your neck. And when you have cervical instability, your vagus nerve is pinched. And guess what? One of the biggest symptoms of a pinched vagus nerve is lack of emotions, emotional disassociation. Disassociation and depersonalization and derealization of emotional consciousness by simply destroying the vagus nerve in your neck. Just with that. Then you look at anesthesia, you look at things like certain types of anesthesia have a significant effect on your emotional ability to process things. So if you go in for anesthesia during a surgery, it's going to not only act in your brain, but it's also going to act in your vagus nerve. Now, that might be all good and everything like that. But what typically happens is post-surgery is that the effects linger. You don't exit a hospital post-anesthesia and go 100% back to normal. Because sometimes the anesthesia doesn't always clear out fully. And because your vagus nerve is so densely packed, and if you have pinching of your vagus nerve in your neck, blood flow is restricted, oxygen is restricted, lymph is restricted. So if you have a weak neck and you're not doing the red ball practices, for instance, you're not doing the things that you need to be doing to keep your neck healthy, and then you go in for a surgical procedure that uses anesthesia, then it's possible that you may have some of these lingering effects of anesthesia issues. And what's going to happen there is that you have what's called POCD, which is post-operative cognitive disorder, POCD. That's a term used. Usually you see that from the ages of 60 and up, that folks who are 60 years and older experience POCD, which gives you symptoms that are similar to dementia. So you have some form of memory loss, you have anhedonia, you have lack of emotion for maybe weeks or months afterwards. And you can also lose your balance. You can get dizzy. You see a lot of the same symptoms of vagus nerve dysfunction, like POTS and vertigo and dizziness and spinning, that you see from vagus nerve damage that you see in anesthesia post-surgery. You also see people's voice getting hoarse, very difficult to speak. Their voice just sounds fatigued. And your voice is a manifestation of your vagus nerve health. So if somebody's voice sounds really weak and very hoarse and very raspy and cracky, it's usually an indication that their vagus nerve is also pretty messed up. So anesthesia doesn't just act on your brain, it also acts significantly upon your vagus nerve. First through your lungs, then through your bloodstream, then it travels through your brain stem, then it affects your brain. But also anesthesia is going to be affecting your gut as well, which is also a huge pool for blood in your body. So when you have an infusion of that propofol in your arm, it's going to go into your vagus nerve and shut that down too. And it's going to bind into your vagus nerve. And if we talk about microtubules, your vagus nerve contains basically a bajillion microtubules all lined up very perfectly up and down. So if anesthesia acts on microtubules, then it's absolutely affecting your vagus nerve 100%. So you got to be very, very careful with anesthesia. So yeah, that's the key thing. Then as far as Barbara, you have a quick question here. What does CO2 do to that too during anesthesia? Well, CO2 buildup can just cause hypoxia, and it can replace where oxygen is able to go. It needs to be cleared out. CO2 buildup is basically just going to cause cellular death, but they don't do that during anesthesia. So they're trying to clear out CO2. So it's not a concern. If you have a good anesthesiologist, they're not going to let CO2 build up in your body or your blood. So no issues there. So yeah, but there's some really interesting stuff on anesthesia that I find to be just pretty insane. There's one other guy that I think you should absolutely check out, who is another anesthesiologist. He's going just crazy these days. He's doing something called, his channel is called Medical Secrets. I think he's pretty cool, and he's pretty funny, and he's handsome, so you ladies will love him. But yeah, his name's Dr. Cave, Medical Secrets. I'm going to post that over on the YouTube as well. Highly recommend Dr. Cave. He is really cool, really entertaining, really knowledgeable. He'll really speak to a lot of the kinds of interesting aspects of going in for surgery and anesthesia that are, I think, relevant to the members of this group. I find him to be just a fantastic resource for just getting some insight. He's really good. So definitely go check him out, 100%. I've gotten to interact with him a little bit on YouTube as well. He's a really good guy. He does a lot of live videos like me, too. Usually he does it from the operating room as well. So definitely go check him out. So yeah, as far as the really interesting aspects of anesthesiology, it's basically going to act upon your vagus nerve 100%. That's unavoidable. What you can do to clear it out is to hum, to breathe, to exercise, to stimulate your vagus nerve. I think that the best way post anesthesia to clear your vagus nerve would be to use ultrasound 100%. So if you have an ultrasound, if you're a client, use your ultrasound post anesthesia. It will help clear out the anesthesia from the binding sites at your microtubules. So you need to get, once the anesthesia goes in, you need to get it out as fast as you can. Not clearing anesthesia gases or compounds out from your body post whatever, post going under, is not good. It can cause some bad stuff long term, that can last for months, and it can readmit you to the hospital. One thing that they found with POCD, post-operative cognitive disorder, post-anesthesia, in folks who are 60 and older, is that they typically are readmitted to the ER very shortly after an anesthetic procedure, because it makes them so off balance that they usually fall down and break a hip. So when you're messing around with anesthesia, it can cause some pretty serious issues. So be very, very careful with anesthesia, especially if you're going in for some kind of a procedure. Now, that's not to say that you shouldn't do a procedure. I think that there's some great surgical procedures that have to be done in a lot of cases. So I'm not trying to say don't go in for surgery, because I think that there can be life-saving surgeries that you can do. But be highly mindful of the effects on basically centers of consciousness that anesthetic gases can have. Now, that's also not to say that there aren't even some therapeutic effects for anesthesia gases that can be provided. But I'm gonna probably do a little bit more of discussion of that just on Facebook, in the private Facebook group. So we'll shift things over there. But for the most part, that's the main thing. So thanks everybody so much for watching on here on the YouTubes. I'll talk to you again tomorrow. Take care. Bye-bye.